Welcome to Office Hours. Whether you're new to the acupuncture profession or have been at it for decades, this is the place where we discuss all things Chinese medicine and more. Join Toby Daly, a seasoned acupuncturist of the Som tradition, and Angelique Britt, a nurse turned acupuncturist who is brand new to the field, as they explore topics in and around the world of acupuncture and Chinese medicine. There's something for everyone here. Drop in anytime.
Hey, Angelique, how you doing?
Hey, Toby, I'm doing pretty good. How are you out there in California?
Everything's going pretty well with me. What's the latest with our viewers?
So we do have some questions. One of them actually was a comment plus a question, which I found very fascinating. It was regarding shifts in the face. So this is a person who has been self-treating, and she mentioned that she did a lung treatment and that her face was fuller and puffier, but not in a bad way. She said it was actually like a good thing, and that lasted for a couple of weeks. And she also said that when she did a kidney treatment, she said it was like putting two vertical lines through her eyes, realigning them and making the eyes bigger. And she said it was like an Instagram filter. And I was blown away because I did not realize that changes like that to the face were actually possible. And so she's wanting to know if you've had experiences like that, if I had had experiences like that. I think I was in a box of limited perception, so I certainly have not had experiences like that, but certainly interested in your takes. And if certain channels, like what you've seen specifically for certain channels, what they have done to the face and that like micro structural change that she's describing.
Yeah, the face should change after every single Psalm treatment, right? If you get all the points right, it's such a powerful shift on the body. It should make some change in the face, some discernible change in the face. I remember my teacher one time, we had a urinary bladder excess patient. He supplemented heart for her, and he asked her to go look in the mirror because she had like apple blossom cheeks suddenly. She was all pale, and then she had these apple blossom cheeks, looked like a young girl. So really, big change from full pale to pink with apple blossom cheeks. So there should be something really discernible. And the qualities that we put in with the Psalm system, those are reflected on the face. Like when you supplement heart, the face is going to become warmer, better, pinker, right, will really pink up, especially if it started pale. All the channels are like that, right? If the face is all dusky and bunched, when we supplement small intestine, it should be much more open, such much more movement in the body, things like that.
That makes sense with regard to the complexion. I've seen shifts in complexion, but like changes to the eyes where it looks like they're more aligned. Like, have you seen that happen?
I don't remember that specifically happening, but I could see how that could happen. The face is basically fixed, but there's still a lot of room with all the micromusculature in the face and things like that. There's a lot of room for the body to change, right? And you can do it yourself, move your face all around, and so you can, especially with the channels, by supplementing those qualities, it's going to have some impact onto the areas of the face that can move. Like yeah, nothing's going to change with your skull, but all the other features in the face, especially eyes and things like that, there's lots of room for changes there.
Pretty amazing. I was really grateful that she had reached out with us because it was perspective opening for me.
Yeah.
It's amazing what boxes we place ourselves in when we don't realize they're there until they get blown open. And you're like, wow, there is a bigger world out there. Things are possible that one would never even think of were possible before. That was
Yeah.
great.
That's a good way of saying about clinic, right? You start off with a small box, then you get a little bit bigger box, a little bit bigger box as you get more and more experience, right? It's like you get more and more space to take things in. I think that's absolutely true. I know there's another practitioner also that was taking pictures of tongues before and after treatment, and that they were noticing really significant changes with the tongue also before and after the treatment. So lots of different areas to look. This tradition, the main area we look at for our feedback about the treatment is the face.
Very cool.
Anything else on your mind?
I think I've got another practical question. I've got another practical question here, trying to find it. Curious what size needles you use on gin wells. That was one.
What are you using right now?
I have 40 by these, and I've been using them for all things. I haven't ordered the 40 by 40s yet, although a new acupuncture friend of mine has ordered a bunch and is going to give me some to try. I couldn't find shorter 40 gauge ones, and so I just have been using the big long ones, which sometimes fall out.
Yeah.
So I was curious for that reason too, what you use.
Yeah. My teacher used half-inch needles, right? I think they're 0.60s or so. His needles are really thick. So he would use half-inch needles because otherwise it's too heavy and the needle handle is gigantic, and that gauge needle. So he would have to use half-inch for Jing wells. Unlike you, I use 0.40 by 25, and that seems to work fine. They don't seem to fall out. Yeah, but if you can get half-inch
Okay.
0.40, I think that's probably ideal if you can find it. It's a little bit difficult to find that though.
Yeah, I haven't been able to come across it yet. I haven't gone into other countries, but just from our suppliers, I haven't seen anything larger than I think a 25 by 15. That's the largest one I saw.
Yeah, there's a opportunity for someone there, right? Because there's quite a few Psalm practitioners now, and I know some other traditions they like to use
Mm-hmm.
thicker needles too. So there's opportunity.
Mm-hmm.
I have contacted the needle supply companies, and they made lots of promises, but one sort of delivered one time, but usually they don't. I think it's probably just they're just not sure there's as much demand as there actually is.
Okay, so what you're saying is that all of us that practice some should just flood Lhasa OMS or our favorite supplier with emails requesting 40
Maybe,
by 15s.
maybe they haven't listened to just me, so maybe to other people, maybe. But for me, there really a lot of people like promise stuff, but it never
Yeah.
materialized. So yeah, try.
Okay.
Okay,
You hear that, folks? Get to your email.
that's right. Angelique has ordered her army of acupuncturists to take action.
Barrage the companies.
What else is in your mind, Angelique?
So I have my first, actually, I have two firsts. So my first patient that has Bell's palsy that I decided I have not ever treated Bell's palsy with acupuncture at all. So this was my first go around. And I said, I'm going to do some. So I got brave and did. And she's a very sensitive person. And when I supplemented, it's on her left, no, I'm sorry, my left, her right. It's on her right side along the stomach channel. And it was along the triple warmer channel as well. She was having pain. She had the sensation that things were coming up and out of her ear. And then there was like rapidly changing different flickerings of pain in different places. So the first channel I supplemented was small intestine. And she's like, wow, I can really feel things moving everywhere. I didn't tell her anything either. I didn't, sometimes I'll tell patients, especially if I sense some skepticism in them, like what I'm trying to do. But for her, I just did it. And so I thought that was neat. And then she came back and the pain in her ear was completely gone. She said it disappeared on the table. So that was really cool. And the sensation changed quality from more like a more of electric to more of just like a tingling. And then the subsequent week she came back. So then I said, if we can come twice a week, that would be great. So she came at the end of one week and then came back at the beginning of the following week and I supplemented stomach. And she immediately was like, wow, things feel like they're drying out. And like I couldn't believe it.
She must
And
have
then of
looked at a
course
textbook
I
before
was
she
like,
came in to
well,
see you.
actually, this is what I did. No way. I mean, no, maybe no. She told this is her. So you got me doubting it now. Not nice. Yeah, she was definitely perceiving that. And then the following week, she came in and she said that she didn't have any more pain and she had some more movement. She was feeling like the corner of her mouth was starting to kind of come up some of the day. When she got tired, it was harder, but especially in the morning, she was feeling some of a corner of her mouth being able to come up. And she was just for her, she was so emotional. She has a loss situation going on in her life. And she was talking about just feeling hot and she was just like noticing everything. And she's a constitutional Sanjiao excess. So I was like, I'm going to supplement liver. And I did. And she was like, I think things feel so cool. And I was like, come on, like, are you serious? So forever and ever am I going to use song with her because she just feels it so much. So those are 3 treatments I've done. And the most remarkable thing, sure, there's been some nice clinical changes, but her ability to sense what the needles were doing was unbelievable. So that was very neat. Have you had patients with that experience?
Yeah,
Like verbalize to you what they can feel?
I work with a lot of monastics, and they can feel the channels really clearly and the qualities. They always report back to me really interesting, like basically like your experience too, really textbook kind of thing. So yeah, I think that's enjoyable when the patient you put it in and they tell you the qualities that they're experiencing are the same. I gave a talk a couple years ago, and it was like in the talk was what were like things I've learned from the Psalm system, and one of them was that the five phase qualities and the six conformation qualities, they're real and they're in the body. We have those qualities in the body, and before using the Psalm system, I would say that's just not, that's like theoretical or something like that. But now with enough experience, I feel like, oh yeah, these qualities really in their body, hot and cold, in and out, up and down, all these kind of aspects of the body, they're present. It's interesting, yeah,
Hmm.
really sensitive patients, they can give us that feedback of what they're experiencing exactly.
Yeah, it was amazing.
Uh, do you ever give yourself weekly skill focuses?
Skill focuses? Is that what you said?
Yes.
And what do you mean?
I mean, like, I give myself every week something to specifically focus on for that whole week in clinic, so I can really make sure I do that every time. Do you ever do that?
No, but that's a fantastic idea. I feel like I'm still very much in the survival mode of getting my clinic up and off the ground and sustainable. I can tell you what I have done,
Yeah,
which
tell me.
is I've decided to take 20 minutes of every day to start reading foundational things again. So I have the first edition of the Gospel of Mattheocha, and I start from the beginning. And I'm just kind of reading for 20 minutes each day, just going back over the basic things because I want to make sure I've got it, just to be like, let's remember. And it's been interesting doing that because my brain that has learned it already is now seeing it a little bit differently. So that's what I just this week have started doing, but I have not done what you have suggested, which is a very cool and good idea. And I will aspire in my
No, but
future to do
yeah,
that.
but you are, right? You are doing that. But I think it's nice to have like a theme for the week and something that you're going to just do throughout that week and then something new next week, because otherwise like your experiences, right? You just get kind of blown away in clinic, and it's nice to have something, at least one thing a week that you're really focused on. So I think, yeah, foundational study for a week, I think that's real, that'd be really valuable. And like you're seeing now before, the theoretical student reading that same text has a totally different eye than the practitioner, right? When the practitioner looks at that again, you think, I've
Hmm.
never seen that table in Maciocha. I've never seen that in a patient. And but then the student thinks, oh, I can't wait to get in clinic because I'm going to be presented over and over again with that table. So I think that's really valuable to do that. Go back and look at the
Hmm.
foundations, the theoretical, and then see how much gap there is between actually what you do in clinic.
Yep. And I will say that the first volume, like volume one, that's a nice one because it's like an inch thick, not 4 inches thick, and it's simpler. I just think it's a nicer read than like the big third edition that they had us have in school recently. So
Yeah.
highly recommend finding that one for
I
review.
I was trained on that first edition, so the
Can
only
you
one
give
I
an
ever read.
example of what are some of the themes?
Yeah, like recently this week, I'm really trying to focus on my posture when I needle. I have a tendency to, I'm 6'5", so I have a tendency to really hunch over for needling. And so I've really been focusing on my posture all week while I'm needling. And I feel like that helps. Again, there's so many different things you could be doing in clinic. It's nice to have that one focus, and then you get a little bit better on that. And then I find that if I do that for a whole week, focusing on something, then that momentum kind of carries into the other weeks when I switch to something else. But in the past, right, I've really had myself focus on like the face, and like every patient just be laser focused on the face, almost ignore what they're saying and just focus on their face the whole time. That's really helpful. That's been a helpful thing in the past. One of my assignments I used to give myself to was make sure every single patient had 3 diagnoses when they came. I think that's been one of the more helpful skill set that I made myself do for a week at a time. Made sure every single person that came in the clinic got 3 diagnoses. That's really played out well for me. Lots of different things I can't think of right now, but yeah, I think it's really valuable. Anything you really want to focus on, it's nice to make yourself do it for a whole week and then switch to something else the following week.
I can tell you that I did the 3 channel thing from the beginning of starting to treat with Sam, especially at my own clinic because you told me to. And it was really helpful because I had to go back to the book multiple times to read through and make sure. And it helped me to learn the system a little bit better. Not a little bit, a lot better, where I feel like I've got a lot more recall just naturally and not having to reference so much on certain channels anyway. There are other ones that I haven't treated as much, but doing that, like picking your top 3 channels has been super helpful. I've definitely
Yeah,
done it more than just once a week or for just one week at a time.
Okay, yeah, that's not a there's not a cutoff for that, but it's nice to give yourself that one laser focused assignment, and then of course, yeah, you do all your other things as well. But I think that that's a
Hmm.
really valuable one. Yeah, come up with 3 diagnoses for every patient because it just makes you work. Usually, the first two usually easy, and then that third one, oftentimes you have to work hard to get that one. All right. I think I told you I'm taking a 3-year herbal program with Volker Scheid. Did I tell you about that?
I don't think so. Yeah, maybe you did. Yes, you did. You
Okay.
did.
Yeah.
Yep.
Anyways,
But I
he
don't
was
remember all the details.
okay. Yeah, he was talking about in the Sheneng Bansao Jing. There's only 3 herbs that generate the new and push out the old. Do you know which 3 herbs do that?
Generate the new and push out the old. I mean, like generating flesh.
Yeah, they don't specifically say what it is.
I'm gonna
But
say generate the new and push out.
does it help you at
I
all?
know. I mean, I could throw out some guesses, but nothing's coming.
Okay, this one I didn't know at all. I feel like I've heard it before, but I didn't know any specific herbs for it. So the 3 herbs that do it, it sort of makes sense when I say these first two. It's Mang Xiao and Da Huang, right? To get rid of the old so that the new can come in. And then the unusual one, the one you spent a lot of time talking about, was
Okay.
Chaihu. Chaihu also does the same thing.
Interesting. In what way?
Interesting in what way? It's nice that to think about what Chaihu does, right, is it doesn't just move things, it also allows the things behind it to flourish, right? We got lots of things that move chi or
That does
move
make
blood or
sense.
something like that, but then to leave things so it can flourish behind it, he's really
Hmm.
saying that Chaihu's are preeminent herb for that. So again, that's just a nice angle on Chaihu I hadn't thought about before.
Yeah, that's really interesting. I was thinking about it in the context of what I've learned with studying the with Sharon Weisenbaum and the concept of the Shaoyang block and the pivot and how Chaihu is a very key herb in allowing the flow of the body's fire to pivot into the right position. So that makes sense with Chaihu being something that unblocks but then allows whatever's behind it to flourish because the fire is then able to move into the position it's supposed to be in. So that is an interesting perspective that is pretty much the same, I think, just worded differently.
Yeah, I think it's a beautiful way to understand herbs from many different theoretical concepts, so you can really understand it. Volker was talking about how in Chaihu, that's the reason it's in Buzhong Ichitong. Remember, Buzhong Ichitong is one of its kind of odd indications is like low-grade fever, right? And he was saying about that, right? How it can push out the
Hmm.
old so that so that fire can get in its proper place. I don't know, something about that really clicked in my mind theoretically to help with herbal medicine. So, anyway, also I find really interesting.
And I just remembered that I didn't mention my second new thing, so I don't want to leave a loose end because we can't have that. It'll be a brief story just because it's exciting. And I haven't done SOM with this patient yet, but I have my first pregnant patient, and she's going to be 33 weeks this Saturday, and she has breech baby. So I get to try the Moxa at bladder 67, which you read about, but I hadn't gotten to try it yet. We talked about using the Moxapol, and I gave her a Moxapol to take home. And I'll see her again Friday and like show her how to do it. But that's like in the window. I think it's like 33 to 35 weeks is when you're supposed to be able to help the baby turn.
Great.
So I thought that was neat. Is there a SOM approach to a breech baby?
We do, right? In general, if it fits, we like to use small intestine for that to get that dynamic movement in the lower part of the body. I don't think I've done that personally, but I have some students that have done that successfully. So that's a reasonable thing to do. Again, if you don't find kidney excess, you can't use that strategy. You have to use something else. But it's not like it's indicated for every breech baby. You have to
Hmm.
have some kidney excess as well there. So you can consider. I remember reading, I think if I remember right, there's pretty good research on, UB67 and Moxa and flipping breech babies. I'm pretty sure like they did that on ultrasound and watched that flip. Have you seen anything like that?
Hmm. Have I seen anything like that? Yeah, I looked up some research studies before just to see, like, is this actually a thing? I did this in school and then I reviewed them briefly again this week when she was there. And I was like, I'm so excited to try this. I'm so excited just to see.
It's really pretty amazing, right? To take, a few cents of a material, right, and then ignite it by a toe and then have such a big physiological change. I really, we're so lucky to be able to practice this medicine. All right. Anything else more you want to say about your cases?
I don't think so about my cases, but I did find a really interesting book that I think other new practitioners might enjoy. I was given some books, and this one, it's called Saplings. It's On the Path to Mastery in Herbal Medicine, and it's edited by Carl Stimson. And for those who are watching, it looks like this. You can see it. And essentially, it is a collection of stories of the first months to years of practice in the words of those that went through it. So basically, all of our predecessors and what it was like. And there's a wide variety of experiences. I'm about halfway through, from really being super successful in the beginning to having a whole lot of doubt, to talks about all the feels that we have as new practitioners. And so I found it a balm for my soul to read it and be like, oh, I'm not alone, you know? So if anybody out there is interested in reading a good kind of short book, it's not super thick, I recommend.
That's fantastic. I love that title too, Saplings. I really feel that's a great as you're first starting to reach towards the light there. Yeah, that's a lot of feels going on then.
It's an evocative title.
Yes. Okay. So I'm going to be presenting soon like an ethical cases class, and so one of the cases I'm going to be presenting there. Do you mind if I run it by you and get your take?
No, go for it.
Okay. So this was a couple months ago. I have a 94-year-old patient I see really regularly, once a month or so. I've been seeing her for a really long time. She's got some cardiac things, but basically she's in pretty good shape. Everything's going pretty well. That once a month just kind of tune up to keep her in good shape. She's doing amazing for a 94-year-old. Anyways, uh, her I get a phone call from her on a Sunday. Usually I don't have the phone, but my assistant didn't have the phone at that time, so I had the phone, and I got the voicemail from her. And the voicemail, she's distraught, and she's saying, "My son, her son's like in his 70s, is having a heart attack. He won't go to the hospital, and he'll only see you," meaning me. And so I got that voicemail, and also what's going on. I want to put you in my shoes, and I want to get your feedback for this. But I'm like an hour and a half away from my office. So when I get this call, what about your first thoughts? How do you navigate something like that? And I'll tell you how I went through it.
First of all, wow, that's a whole lot of pressure. As you know, I'm a nurse. Wow. So you by chance had the phone. So I'm curious about some other contextual things. So would your assistant have otherwise had the phone?
Yes, but she would just refer to go to
Like,
the
would she have
hospital.
gotten this phone call?
Yeah, but she's trained really well. She would just refer to,
Okay.
you have to go to the hospital.
Okay. So you get this call and you have an emotional attachment to this patient. You're treating her a long time. Goodness, and you're an hour and a half away and it's a Sunday and he's having a heart attack. I would be so worried that he would die. I would call and try to convince this person to go to the hospital. I mean, time is of the essence with a heart attack.
That's exactly
I
what
would
I
call
did.
it. That would be my first thing.
That's exactly what I did.
Okay.
And the patient,
And what did they say?
they continue to refuse. They will not go to the hospital. They will not call 911. It's your step two.
Why? Did they tell you why?
I know they just had a whole bunch of horrible experiences in the hospital, and so now they're distrusting of the entire hospital systems. I disagree with this, but that's where that patient's at. So you made a really compelling argument that you're not equipped and well suited to treating something like that, and you're an hour and a half away. You made that argument. The
Yeah.
patient refuses that argument and
Yeah.
will only see you. What's your response to that?
So I would probably, in that circumstance, God, I like feel it in my heart right now. I would
Yes.
feel so bad, but I don't think I would have treated them. I mean, you're an hour and a half away. Who knows if they would even live that long? My God, there's part of me that almost wants to call 911 for them, but I wouldn't do that because I think that people have the right to make bad decisions.
Yeah.
I don't know. I don't think I would have done it. I mean, there would have had to have been some other compelling reason. Because liability wise too, like if you go and you try and do it, but then on the other hand, if you actually could have helped, that's super tough. There's also the boundary issue, like the boundary situation. So I know, having done nursing and home care for a really long time, that there comes a point where you have to draw a line just in order to preserve your own self and to get calls like that on off hours and then respond to them, I feel like, whew, tough one, tough one. I think my verdict would be I probably wouldn't do it, and I would have been so apologetic and explained that I was an hour and a half away and that acupuncture was probably not the approach. And I know that there's been great results with your mom, and I want you to go to the hospital, and maybe I can go and see you there. Yeah, goodness. So what did you do?
It doesn't have a great, unfortunately, I wish that this was a great case study. Everything goes amazing. This is a real life one. So what happened is I said, okay, I'll be in my office an hour and a half. I just wasn't sure what else to do. I think now that you've explained it, right? And I think maybe if I had more time to think about it, might have refused. But still, in general, I just want to help. And so I think that probably, he just will not go anywhere else. So en route, by the time I got there, he died.
See?
Yeah, we just
Damn it.
refused.
I
He
knew it
wouldn't go.
because it's like,
Yeah, yeah.
that's too bad.
The other thing too is I didn't,
Goodness.
yeah, I didn't know exactly where he was. I presented this case also at White Pine Circle. I did ethics class for them, and I presented this case, and somebody said that, oh, you can have 911 reverse the whatever the telephone numbers that they called you from, which I didn't realize. Now I understand that. But so it couldn't even force, an ambulance on him, even if I wanted to. But now I understand that you can do that with 911.
That's good to know. I didn't know you could do that with 911. But yeah, that's rough. I have a mixed response because part of me, like I feel deeply when people call for that and you know that you might be able to help, but at the same time they're making a decision that you also know medically it's just like, oh God, you're gonna, you could totally die. And also putting that on you to do, like I will only see you. You're the only one.
Right.
Oh man, that's dangerous sometimes, I think, because when you're pedestalized like that, is that how you say it? Pedestalized.
I know what you
Anyway,
mean.
when you're put on a pedestal by people, the higher the pedestal, the farther you can fall. And like, God forbid you went and you tried and then he died and they were like, you killed him,
Right.
Jeez.
Right.
It's slippery.
Yeah. So, anyways, that's unfortunately it was a difficult situation to navigate, but I think it's interesting for the ethics case study class. I think that's interesting. It really evocative because it was such a high pressure situations. Yeah, I think again with perfect knowledge and then that feedback from before, I think I would have forced 911 on that patient, what I didn't know I could do before.
Mhm. You do. So if it ever happens again,
Yes.
maybe that's part of it, that whole learning thing.
Yes.
When are you doing the ethics class? Because I know there's a bunch of us that need that for our NCCAOM certification.
I had a date. I know Seattle invited me to do an ethics class, or sorry, not Seattle. It'd be in Seattle, but it's the Washington State Acupuncture Association. They invited me to do an ethics class, but the date was fixed, and now it's not fixed. So I don't have anything right now, a date for that. But that class is coming.
Of yours specifically?
Yes, of that ethics class.
So, from an ethical point of view, if one of us were to get a call like that tomorrow, what do you advise?
I think we're not really well equipped for emergency cases like that. Let's say we're in a remote area and we're the only responder there. I think that's all you got, then you got to do what you got to do. But I think especially for modern ED, it's the best place in the world to be with a heart attack. Right. So why you would take somebody out of being the best place in the world for their current situation, I can't ethically advocate for that. This was such a unique situation that the patient would not go to what I felt like was the best possible survival place for them. And so I was a way down the list, second option for them. But they wanted to elevate me to the first option. So I agreed to do that, even though I thought that was not a good idea. Again, in the future, I would just say the exact same situation again, then I would just force 911 and get them to where I thought was the best thing. Again, you can argue about this later, but now we don't get to argue with the patient. The patient's passed away. So I feel like
Right.
number one thing is survive, and then you can talk about other things after that. And the best place to survive with a heart attack is modern ED.
Yeah, for sure. Strokes, heart attacks, anything related, go to the emergency room.
Yeah. Again, we can do all kinds of Chinese medicine later. they've got a trained team for that. Unless, I think especially like in China, there's a lot of people with more experience with that, with acute things. But if you don't have personal experience with that, a couple decades of personal experience with that acute situation, then I think it's much better to give to people that do, which is modern ED.
Yeah, for sure.
All right. So I always thought it was a little bit weird that I spend a little bit of time trying to convince people to go to medical doctors. I didn't think that was going to be my role at all, right? I thought I was always going to be, working with people that weren't that interested in Chinese medicine, but it seems like more and more, especially as people have worse and worse experiences in the
Uh-huh.
hospital, right? Then it gets harder and harder to convince them to, get care that's really best served there.
Yes.
All right, Angelique, let's leave it here. I've got a few other things, but maybe let's discuss it next time. Right? Everyone, thanks so much for hanging out with us, and we'll see everybody next time. Take care, okay?
All right. See you next time. Bye.